To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we are talking about runner's knee. We're going to tell you what that means with Dr. Marjorie Delo from Delo Sports Medicine. Hi, doctor.
Hi.
The weather is nice, and we like to get outside. We like to be active, but that sometimes can lead to an increase of your patients. How come?
Well, one of the most common things you'll see in a sports medicine or orthopedic clinic is anterior knee pain, or pain right behind the kneecap. That's produced when there's a lot of flexion and extension of that knee going on. So this time of year when people are starting their walking programs or their running programs and they're doing that repetitive movement in the knee, but the leg isn't conditioned to it yet, it will cause pain of that cartilage behind the kneecap that we can call chondromalacia patella or runner's knee or anterior knee pain, lots of different names for that.
Yeah, your knee gets angry and says, what are you doing? How do you specifically diagnose what is going on?
Okay, so some people will call patellofemoral pain a diagnosis of exclusion, meaning we want to rule out other badness. So it's always reasonable to get an x-ray, make sure there isn't significant arthritis in that joint causing the pain, or on exam that there isn't ligamentous instability or signs of a meniscal tear. But typically on exam what we find is there's just tenderness behind that kneecap, and that there's biomechanical abnormalities, so that kneecap is popping or grinding as opposed to gliding in the groove where it's supposed to run.
Right, and once we find out it's not like a tear, how do you get us back? How do we get those knees to work properly again?
So to get them to work properly is usually working on the muscle imbalance. Look at that whole kinetic chain and say, okay, why is this kneecap grinding? Why is it not gliding? And that can be many things. It can be if someone has abnormalities of their foot and ankle that aren't being corrected, if their iliotibial band is extremely tight, which is most commonly associated with some weakness in the hip muscles, if their quadricep muscle is fatiguing when they're doing these activities, all those things will contribute to that kneecap actually kind of moving out sideways out of its groove and causing that pain.
And so at your practice, super quick, how do you, when you see these, how do you fix them?
Well, of course, number one is going to be looking at those abnormalities. How do we correct those? Some kind of rehab, whether it's from the athletic trainer in my office or sending you to work with somebody. We do have taping techniques with kinesio tape or braces that can hold that kneecap in place while you're doing your activities, so you don't necessarily have to stop. Sometimes we'll put something into the joint just to calm down inflammation or to heal that cartilage, and those are of course options too.
Well, doctor, thanks so much for being here and helping us get out there and be active again, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.